Welcome to this presentation on healthcare policy in Wisconsin. So now, let's dive into it. Fertility pertains to the ability to procreate. In opposition, infertility pertains to the inability to conceive after trying for at least a year. Per the National Infertility Association, in 2025, an estimated 738,286 females in Wisconsin are facing fertility challenges. Reproductive endocrinology and infertility, or REI, is a healthcare specialty that focuses on infertility. A stable treatment of REI clinics is in vitro fertilization, or IVF. Per MacOLife in 2025, out-of-pocket expenses can exceed $25,000 for one single cycle of IVF. USA Facts 2026 underlines that Wisconsinites earn an average salary of $62,504, which is below the national average when adjusted for cost of living. This is crazy considering that many IVF cycles are needed to achieve pregnancy. These factors make fertility care a health equity issue and highlight the need for targeted legislations to expand access to fertility care. Currently, Wisconsin lacks comprehensive legislation to promote access to fertility healthcare services. I identified 3 potential health policies designed to improve access to reproductive health services in the Badger State. Those were the Infertility Treatment Coverage Act, the Fertility Grant Initiative, and the Reproductive Healthcare Transparency Act. After examination, the Infertility Treatment Coverage Act in Wisconsin is the best policy option because it improves access to care, best supports clinicians, and addresses a critical gap in healthcare equity. This is a state insurance policy for infertility treatments, mandating health insurance plans to cover diagnosis and treatment of fertility services. According to Wood and al. In 2024, evidence shows that states with such mandates see higher utilizations of fertility services, reducing financial barriers and supporting individuals who want to build families. This implies that insurance coverage requirements for fertility services promotes healthcare equity. Implementation of this policy in Wisconsin would increase access to IVF and related services, especially for middle-income individuals who cannot afford out-of-pocket costs. This policy directly addresses a major barrier to fertility care: cost. By reducing the financial burden through insurance coverage, the policy reduces inequalities in access to fertility care. It may also normalize infertility treatment as a standard component of healthcare rather than a luxury service. Together, Wisconsinites and advocacy organizations representing them are at the heart of the policy. If implemented, the policy's outcome would directly benefit their purposes. As far as fertility clinics and providers, if the policy is implemented, they would have to take initiatives to work with insurance, educate their staff on the coverage of their services, and possibly in adjusting their cost if the increased coverage drive the cost of services to go down. The policy could also result in a greater demand for their services, which in turn could require increased staffing. For state legislators, their role directly influences agendas and actions of legislators. In implementing the policy, state legislators would have to partake in the modification process as necessary to ensure that the policy remain effective. How they engage with individuals and advocacy organizations inherently shapes how the policy is enacted and modified. Last but not least, the insurance companies would have to implement the required coverage changes. Their role would directly impact affordability and access to fertility treatments. Ultimately, the successful implementation of this fertility healthcare policy depends on coordinated efforts among these stakeholders. Together, patients and advocacy groups, providers and clinics, legislators, and insurances shape how fertility care access, equity, and outcomes evolve in Wisconsin. I chose this policy because it enables providers. UNCP 2024 highlights how physicians have to spend significant time navigating insurances. Sometimes a preferred treatment cannot be afforded. This hinders the decision-making process and can delay treatment. By requiring insurance to cover treatments like intrauterine insemination or IVF, provider can deliver comprehensive care without being hindered by insurance-related costs or criteria. The policy helps making healthcare decisions more about the medical needs than a patient's financial situation. I chose this policy because it improves treatment continuity and outcomes. Shen et al. 2023 underlines how lack of insurance coverage can hinder patients from continuing treatment due to costs. Without coverage, patients do not complete their fertility treatments, which in turn decrease their chances to procreate and build a family. I chose this policy because it tackles inequities in accessing care to fertility services in Wisconsin. As I mentioned earlier, treatment can cost thousands per cycles. MicroLife 2025 highlights how baseline IVF cycle prices in Wisconsin have risen from $9,000 to $10,000 in the early 2020s to $12,000 to $15,000 by the mid-2020s, with medication costs anywhere from $2,000 to $7,000 and additional procedures such as genetic testing increasing total expenses. Compared to the grant program policy or the Reproductive Healthcare Cost Transparency Act, the infertility treatment coverage policy applies without restraints. What I mean is that this insurance mandate policy does not reach a grant's limit, it does go beyond raising awareness. This policy supports treatment of a more diverse patient population rather than only those who can self-pay or win financial assistance. Ultimately, there's a form of ethical obligation to the policy to make procreation, family building, and parenthood accessible to all. Now, let's talk about why it is the best choice for healthcare clinicians. First, this policy improves clinicians' ability to deliver care. Right now, many providers face a difficult reality. They know the most effective fertility treatments, but their patients cannot afford them. This creates a gap between what clinicians can recommend and what patient can actually access. With mandated coverage, clinicians can recommend evidence-based treatments without financial limitation driving care decisions. Second, the policy enhances patient outcomes. Infertility is a time-sensitive condition, and delays in treatment can significantly reduce success rates. When insurance coverage is available, patients are more likely to seek care earlier, follow through with treatment plans, and maintain consistent follow-ups. This leads to higher success rates and better overall reproductive health outcomes. Third, the policy supports professional standards and practice. Fertility care is part of reproductive medicine guidelines, and clinicians are trained to provide these services. However, lack of coverage often leads to fragmented care, delays, or incomplete treatment. By ensuring coverage, the policy allows clinicians to practice in alignment with professional standards, improving consistency and quality across the healthcare system. The policy strengthens the patient-provider relationship. Trust is a critical component of healthcare. Cunningham, 2008, stresses that when patients know that the recommended treatments are accessible and not financially out of reach, they are more likely to trust their provider and engage in care. This leads to a better communication, stronger adherence to treatment plans, and more collaborative healthcare experience. Overall, the policy empowers clinicians to provide the best possible care while improving outcomes and strengthening relationship with their patients. Now let's talk about why this matters now. The policy recognizes infertility as a medical condition, not a choice. According to the World Health Organization, it is defined as a disease, a reproductive system failure. It is diagnosable and often treatable. WHO also emphasizes that reproductive health is a fundamental part of overall well-being and that individuals have the right to pursue family building. Waiting to take care of infertility issues is potentially contributing to depression, anxiety, and long-term emotional distress. Supporting access to treatment is not just about reproduction, it's about improving health outcomes. From a socioeconomic view, the need for the policy becomes even more urgent. Per Resolve 2025 in Wisconsin, infertility affects about 22% of the population, excluding cases of male infertility. This is a time the state is already experiencing declining total fertility rates, or TFR. KC 2025 underlines that Wisconsin faces declining fertility rates and significant disparities in reproductive healthcare access. Due to the declining birth rate and an aging population, a 3.11% population decrease is anticipated by 2050. WASH 2026 states that maintaining a stable TFR is essential to avoid sub-replacement fertility levels and a downward economic trend. The policy helps addressing demographic and population concerns that must be attended now in order to tackle the downward economic trend. Ultimately, the policy pertains to issues of equity and population needs. It is beyond compassion. It pertains to thinking ahead and the benefit of the state. Here are special considerations. According to Carson and Callan, there are many factors to infertility, including lifestyle and environmental factors. While the policy improves access to fertility care, it does not address root causes. WHO highlights that fertility awareness is essential. Policymakers should expand access to REI services while prioritizing education and screening. As well, increased access will raise demand for fertility services. Per the Wisconsin Hospital Association, the state workforce is not growing fast enough to meet current needs. The policy could worsen staffing shortages. Insurance premiums may also rise to offset coverage costs. Despite these challenges, long-term benefits such as higher fertility rates, economic stability, and improved population health may outweigh initial costs, supporting a stronger workforce and a more sustainable society. To conclude, Wisconsin's lack of comprehensive fertility policy has created significant inequalities in access to reproductive health care, particularly for individuals facing the high cost of fertility treatment. The Infertility Treatment Coverage Act targets these barriers. The policy aims to address financial barriers to fertility care and promote equitable reproductive outcomes. Without targeted legislation, REI healthcare services will remain inaccessible for many Wisconsinites. Developing fertility legislation is essential for improving individual health outcomes and reproductive autonomy, but also to address broader demographic and economic concerns related to declining birth rates. Supporting this policy is more than expanding benefits. It's acknowledging reproductive health as essential healthcare and empowering clinicians to provide the care their patients need. Ultimately, no one should have to endure years of emotional and financial trials to build a family. The policy attends to the responsibility of doing something, helping individuals, not hindering them. I look forward to the enactment of this policy for the Wisconsinites. I hope this is only the beginning of a movement that will extend to the country, even the globe.